good afternoon. I'm Ed Hughes. I'm the Chief Executive Officer at the Council of Deans of Health, and it's a great pleasure to welcome you to this webinar this afternoon on the Research Excellence Framework, which is going to be led by Professor Jo Rycroft-Malone, who is Executive Dean at Lancaster University and is, more importantly in this context, the Chair of Unit of Assessment 3, the subpanel to which many nursing, midwifery and allied health professional researchers will be submitted in the forthcoming Research Excellence Framework. I'm sure you don't need reminding that the REF is a hugely important part of the fabric of higher education research and funding, not only driving research investment by government, but also important in league table rankings, in reputation indicators and in institutional research policy in various different ways. And so it's a great opportunity to hear about the latest developments in the REF. There's been a lot of activity recently as the programme has developed, and Jo will be able to update us on how that's going, the work of the panels, and some ways in which we as a community can engage in that work in the future. We've got some slides which we'll work through in the next little while, but please do put questions or comments in the chat function. You can find the chat at the bottom toolbar of Zoom for those of you perhaps more used to using Teams, but it's there under chat. Please do put your comments and questions in there, and we'll pick those up in discussion after the presentation. So now I'll hand over to Professor Rycroft-Malone, who can introduce this afternoon's webinar and talk us through the latest developments with the REF. So, Jo.
Many thanks, Ed. So first of all, let me pass the first test and share my screen with you. It's fantastic to be here. Thank you for inviting me. I hope this will be the first of a number of opportunities that I can come and talk to the Council of Deans of Health through this REF cycle process. Let me just check. Are we okay seeing my slides? Because I can't see anything but my slides now.
Yeah, yes, we can see.
We can see those, Jo. Quick question. Are you happy for these slides to be shared with participants after the...
I think, we're sharing the webinar. I think if we can share the webinar rather than distribute the slides, that would be great. Thank you. So my plan for the next 20-ish minutes or so is to do a bit of a run through the principles, the functions of REF 2029, bit of a reflection on the explicit differences between REF 21 and 29, a bit about panel structure. As Ed said, there's been a lot going on. There's also was a bit of a pause at the end of last year to tell you a little bit about the decisions the other side of the pause, and then where we are at in terms of the phases for REF 2029. And as Ed said, I'm interested to also engage you as a really important community in the work that we're doing at the moment around unit of assessment descriptor, and also get some advice from you around long form outputs and extended research process for unit of assessment 3, and as Ed said, there'll be an opportunity for questions and answers after I've run through these slides. So, as probably many don't need reminding, but I feel I should remind us about the function really of REF. So around £2 billion worth of grants are distributed through the outcomes of the REF process. That's distributed differently across the 4 countries of the UK, but it's a lot of money that's tied into the output and the outcome of the REF process. Of course, therefore, it is an important exercise in ensuring accountability for spending public money. But it also really importantly gives us a sense of the health of the different disciplines, and for us, for Unit of Assessment 3, the health of the disciplines in Unit of Assessment 3. So it's really important that the process is rigorous, it's inclusive, it's collaborative, but it's also it engages the whole of the system, and including people who are not part of higher education, so including those that are the are decision makers and the recipients of the research that we do. So very much REF is driven by the robustness of the assessment process. It's very influential on, as we know, on research culture in our organisations and the system as a whole. But we also need to make sure that the bureaucracy concerned with undertaking REF is balanced, it's proportionate. And the policy framework that has been developed for REF 2029 is very much focused on balancing those different priorities, the robust assessment, the impact that REF can have on culture and burden. So we're all working in a very challenged higher education system at the moment, and this is something that is particularly of importance and of relevance for REF 2029. So actively balancing the decisions around the confidence that people will have in the system, but the burden that there may or may not be with the process, but also thinking through what we do from an implementation of REF 29 point of view in the way that it might impact culture because of the sort of incentives that it creates. So it's really important that we find a really good balance through the process. So the main differences, just highlighting briefly the main differences between REF 21 and REF 29, although I will thread some differences through some of the rest of my slides a little bit later. But the main differences, the three elements are familiar, but they've been renamed and the content has been adjusted, and also the weightings have been rebalanced. So I'll talk a little bit more about each of these areas through the slide set. But so what used to be called environment, what was going to be called people, culture and environment, is now the other side of the pause process: strategy, people and research environment. The weighting to reflect the importance of this is up now to 20% of the overall process. What was the outputs element has now been replaced by contribution to knowledge and understanding, and the weighting is now down a little bit from REF 21 to 55%. And engagement and impact, so there's no big change from REF 21, but there is, as you see, a greater emphasis on engagement in relation to impact in the REF 2029. And what you probably have also noticed is that REF 29 moves away much more from the assessment of individuals to think much more about the system, the context and the environment that we set up in the higher education sector to enable people to flourish, enable them to do excellent research. And there's HESA informed volume measure activity going on in our system at the moment, which will result in us knowing the number of outputs and with people with substantive links that we will be submitting to the REF process, and that's happening this year and happening next year. So very high level main differences between 21 and 29, some similarities, some slight differences. The way that the process is set up is very similar to 21 in the sense we have the 4 main panels, slight wording change to main panel B, and we also have the same structure of some sub-panels underneath those main panels, and we're advised by Research Diversity Advisory Panel and also People and Diversity Advisory Panel, making that point around ensuring inclusivity in the process is absolutely critical. So what we've been also doing, really sort of being sure about in terms of our processes is trying to ensure, whilst there's disciplinary differences across these main panels and even within, of course, these main panels, that we're setting up a process that is as consistent as possible whilst recognising some of the disciplinary differences, and I'll mention one of those a little bit later. So you will probably have remembered that in September there was the announcement of the pause from Patrick Vallance, and that resulted in approximately a 3-month pause in the programme of work. So it might have felt like a pause to you, but work was still carrying on in the background, and very much aligned to that policy framework that I put up in the slide earlier, trying to think about the sector balancing burden, bureaucracy, with robust assessment processes. So a lot of work to try and get to an outcome that the sector was content with. So the other side of the pause, which was December, we confirmed the weightings. I mentioned the strategy, people, research environment guidance, also guidance around contributions to knowledge and understanding, engagement and impact. We also had an updated timetable, but the actual end of the process in the terms of submission and the outcome of REF2029 hasn't changed. So we're still working to that same timetable. And at the same time, the People, Culture and Environment pilot report was published. So if you haven't had a chance to have a look at that pilot report, it's worth having a look at, because some of that will be feeding through into our suggestions around strategy, people and research environment. So as I said earlier, confirmed weightings now are, as this slide suggests, 55, 25 and 20, and the sector seems to be comfortable with those weightings. The strategy, people and research environment section has been renamed away, as I said, from people, culture and environment, to focus attention on the fact that strategies are active ways that institutions respond to potentially challenging operating environments, and that the emphasis on strategy also reflects the introduction of an institutional level statement. So it's very focused on valuing people who undertake the research, encouraging sustainable ethical research practices, but also really strongly focused on inclusive environments. So whilst culture isn't in the title, culture is still going to be something that we're interested in learning and hearing about in people's submissions. So as I mentioned, 20% of the total value, if you like, of the profile. The split between the institutional statement and the unit level statement is 60%, 40%. We are going to be incorporating findings from the PCE pilot. Also, as this slide suggests, encouraging in the narrative a sense of how, and this I think is particularly important for the sort of challenges that we're going through at the moment, how we've managed, how we've navigated through some of those challenges, and in being an honest account in doing so in this SPRE sector. And we'll also be interested in the different people who make up our research community. So not just focused on researchers who have had the sense of the other people that contribute to excellent research, such as our technician colleagues. And there also will be this focus on statement of representation. So the statement on representation, again, it's focused on trying to understand or give us some information about health of the disciplines, around understanding the sort of diversity of both people and the type of research that we do within Unit of Assessment 3. And now, instead of those statements being part of what was going to be the contribution to knowledge piece of the submission, it's now this is going to now form part of the unit level statement. So this is the opportunity for us to reflect where we do have the diversity and equitable practice, and sustainability, etc. What we want to see essentially is the sort of the way that our disciplines reflect that great diversity of outputs and the type of research that they do. This also links, I think, a little bit to the reintroduction of a maximum number of outputs, so 5 outputs per researcher, and I'll come on to that in a couple of slides. So the sense was that we wanted to, as an exercise, wanted to reduce the pressure on individuals by removing the minimum requirement, so that still exists, no minimum requirement, And it's still possible for institutions to exceed the maximum number of outputs with an explanation for why. And the explanation will be in this statement, in this unit level statement. So essentially trying to strike that balance between encouraging representativeness, supporting equity, but also maintaining a sort of a confidence in the process moving forward. So this is one of the, I think, probably the biggest changes in terms of from REF21 to REF29. So we will still be focused though on vitality and sustainability, as in REF21. The institutional level statement will be being assessed by an institutional level panel, and that panel is still being constituted. But the unit level statements will be assessed by the sub-panels. The working practices in terms of how the institutional and the unit level will work together, that's still being worked through. Obviously, if we're working at unit level, we will be interested to know what the institution is saying about their strategy, people, and research environment. So those are the things that we'll be working through when we're working through our working practices and working methods. And like REF21, we will be interested in both the qualitative, the narrative, if you like, as well as quantitative data, and the sort of metrics, the indicators that we'll be encouraging people to use. Those are the sorts of the things that we're working through at the moment. And as I mentioned earlier, the sort of narrative around a journey of where an institution and where a unit has come from and got to will be really important to see as part of this part of the submission. And we also are very keen and will be receiving advice from both the people and diversity panel and the research diversity panel to help us ensure that we're reflecting in our working methods that sense of understanding the diversity of people and the diversity of research that is in Unit of Assessment 3. So contribution to knowledge and understanding, outputs in old language as in REF21. So we're still developing the rules, if you like, pertaining to outputs. There is some, as you'll be aware, if you've been reading the guidance, the guidance is there, was published last year. It was updated in 2025. So I do encourage you to have a look at that. And I've said a little bit about how we've shifted that suggestion around a statement to be part of now the SPRE section. But the main sort of changes from REF21 is this notion of decoupling. So we've mentioned that sense of decoupling outputs from individuals. We won't be collecting staff details as part of the process, but we will have evidence of a substantive link from HESA codes of individuals to the output links. And as I mentioned earlier, we've removed the minimum, so minimum of 0 essentially, but we have now introduced a recommended maximum of 5. But as I mentioned earlier, it is possible for submissions to go over a maximum of 5, but we would want to see a reason why that submissions were going over a maximum of 5, and that will be explained in the SPRE statement. And we're introducing a new process for unit reduction requests as well. So engagement and impact. So obviously we're interested in engagement and impact to really understand how our research is having that benefit and very much that piece around accountability for how we're spending public money. Key changes again from 21 to 29. So I think within the process, we will be encouraging very much a discussion around the engagement strategies, a bit more like REF14 for those of us who remember 14. Different from REF21, we have removed that 2-star quality threshold for underpinning research. So that enables a greater diversity of underpinning research to be evidenced from the impact story, and also the minimum number of required impact case studies. It's now 1, so with a submission of 9.99, it's now 1. Although if it's over 10, you can, if you wish, submit 2, but there's only an expectation of a minimum of 1. And of course, you know, as with all of the outcomes of the REF process, eventually all this gets published, and so it is a great opportunity for us to celebrate the way that we are generating impact from our research through the publication in the impact case study database. So in terms of where we are in the REF cycle, we, as you see from this, we've just started. We're very much at the front end of starting to develop guidance. In particular, we're starting to develop our criteria setting process. Plan is for full guidance to be set in the autumn, and then special requests from then on in. And as you can see, this slide plots the next steps until the outcomes of REF2029 are published. What we are doing at the moment in terms of the criteria setting phase, these are the sorts of issues that we are considering. I'm going to come to unit of assessment, descriptor and taxonomy, and also long form and extended process in a couple of slides. But also, as I mentioned earlier, this idea of the statement of representation and statement on research community is going to be a really important part of what we're doing. So it's important that we get that right in terms of the expectations on the community and the assessment processes, and also the sort of templates that we'll be using, that we'll be putting out there for use to identify the great environments that you want to be describing in your submissions. There's also still work ongoing around how we're going to manage interdisciplinary research. For those of you who remember in REF2021 and having to identify what we thought was interdisciplinary research through red flags, all that we're considering at the moment in terms of the best way to both flag metaphorically, but actually deal with actually in practical terms interdisciplinary research. So we get a good sense of that across the submission process. We're also currently working on looking at the engagement impact introduction text in the guidance, and also the assessment criteria. So I feel pretty clear that obviously we're assessing impact. How are we going to take engagement processes into account in terms of assessing impact? Those are the sorts of conversations that we're having at the moment, as well as the institutional level template and indicators. There's also a working group happening to understand how AI may or may not be used in submissions and may or may not be used in assessment. So that's going to be, I think, particularly interesting given the developments in AI between the last REF and where we've got to with this REF. So where we are at, which and Ed alluded to this a little bit earlier, and where it's an opportunity to definitely seek your engagement at this stage, at this very, very early stage, because we are literally a month or two into this. We are currently looking at unit of assessment descriptors and then subsequent to that taxonomies. So we've been using the REF2021 unit of assessment descriptors as the basis for REF2029, and this is partly this point around reducing burden and bureaucracy within the system, not to just throw everything up in the air and start again. We've got a good starting point. So starting with that descriptor, but recognizing there might have been some changes since REF 2021, and then aligned to that to develop a taxonomy. And that taxonomy obviously will need to be related to the descriptor, but will be helpful for us to go out to the recruitment stage in terms of for assessment when we get to that assessment phase of REF. So we still need to go through a round of recruitment. We haven't got our full panel yet. So the taxonomy is going to be useful for that. The taxonomy is also going to be useful when it comes to allocating outputs to reviewers in the assessment phase. And what we want to try and do is get this descriptor done and out there as soon as possible, because this is going to be, the descriptors are going to be what institutions are going to need to map their substantive links to. So it's going to be important in terms of clarifying the HESA returns in terms of substantive links into the units of assessment. So we want to try and get this out as soon as we can, and equally want to get the taxonomy out as soon as we can too. So what I've got here is a draft descriptor, and there's quite a lot of detail on this slide. And what I will do is perhaps share these descriptors separately so they can be circulated, Ed. And also when we get to the taxonomies, similarly, I'm not sharing the taxonomy today because it's still in development. So you'll recognize this for those of you who are familiar with REF 2021. It's not greatly different from the descriptor for REF 21. We just feel that we've perhaps tightened, at this stage, tightened it up a bit. It would be helpful for us at this stage, which this isn't about wordsmithing the descriptor, but to understand whether there are things that are missing, essentially, or things that are wrong in this descriptor. So that's the sort of descriptor of the fields of the disciplines in Unit of Assessment 3, recognizing that we've got that real span of sort of basic to much more applied and then implementation type of research. And that's also reflected in this boundary statement, where we really would encourage units to submit their work where you think it fits best. But we also recognize that sometimes that's quite challenging to understand where that might fit best. So we want to ensure we've got enough of blurry boundaries for people to feel that they've got some home for the research that they'll be submitting. And we are expecting in this unit of assessment, if it's anything like REF 2021 and previous exercises, we'll get a real mixture of research coming forwards, and a real mixture of methods, and a real mixture of disciplines, and they will butt up against these other units of assessment on this particular slide, unit of assessment 1, 2, 4, 5, etc. That was definitely our experience in REF 2021. So we're keen to get some feedback on this descriptor, and Venora Hundley who is the chair of the research committee at the moment, has very kindly agreed to receive feedback as well through the Council of Deans for health processes, as well as I'm very happy to hear feedback from you now, but also after the webinar. Meanwhile, we are working on that taxonomy, which will unpack that descriptor side, and that is still under development. And if we're able to, probably through Venora, we will share that with you and also seek your feedback on that taxonomy. So getting near to the end now. So you also remember this issue around portability. There's been a big discussion around moving, obviously, from decoupling outputs from individuals, shifting the exercise very squarely onto institutions. Through the pause process and through further consultation, that we got a lot of feedback that works well for some disciplinary areas, less well for other areas. And I think probably we can say largely this is an issue for outputs that tend to be in main panel D areas. but we have been giving some thought to how more what we've called long form and extended process research could be portable for up to 5 years. As I've said, it's this. I think it's going to be typically for main panel D. Those long, years of working up a monograph, for example. But we are keen to understand whether there are long form outputs that are relevant to Unit of Assessment 3 that we would need to consider that portability element for, and that sort of extended research process that results in a long form output. So far, the sort of outputs that we've been considering are, for example, NIHR reports. So those were the reports that if you had NIHR funding, you would have had to develop a report that went into the NIHR journal library. Considerable amount of programmatic research that is then bundled into that report. So that would be one example, I think, for Unit of Assessment 3, where we might consider that portability issue. But we're really keen to hear from you if there are other types of examples of outputs that might be considered long form and why they would be considered long form. So that's pretty much what I wanted to say this afternoon. As you get a sense, from what I've said, we are very much in the early stages of developing our criteria, but also our working method. So there's some knowns that are out there in the public domain. There are still some unknowns, and I've given you a bit of a flavour of the sorts of things that we're discussing at the moment. And we've got a fair amount to work through still, as you can tell. And therefore, I'm very happy to come back at relevant points to talk to you more about how things are going. But for now, I'm going to be quiet. I'm going to try and stop sharing my screen, and I think we'll have chance for some questions.
Great. Thank you.
Well, I can't see.
Thank you so much, Jo, and thank you for those words about where we are in the process. There are some questions that have come through in the Q&A, and colleagues, please do add some of those in. If it's helpful, Jo, I can work through some of those.
Please do, yeah.
Then a couple of which have been sort of partially addressed as you've gone through, but maybe a bit of clarification. And then we can maybe also encourage people, if you've got comments on the questions around the unit descriptor taxonomy and the long form outputs, if you want to put comments in the chat, we can capture those today. But otherwise, we will through the research strategic policy group at Council of Deans of Health, make sure there's a mechanism for gathering views and feeding those back into the panel on those as well. But please do use the opportunity today to put your comments and thoughts about those sort of fundamental questions into the chat. So you talked about the UOA3 descriptor and trying to get that out as soon as possible, and because of the need for people to think about how that maps onto HESA returns.
Yeah.
Do you have a rough date as to when I suppose it's not for your the UOA3 descriptor, but actually across the exercise, when those descriptors will be available to the community?
I think, and it's dangerous, isn't it? Because I'm not in charge of the timetable. But I would hope that June, July potentially might be in a position to be sharing those, because we're all in that first bit of the process, and we're meeting, all sub-panels are meeting between now and May. So I would hope that potentially June, July, there will be something there.
Great, thank you. And I guess if people are looking at early work on that in the meantime, probably starting with the draft that you just put on the screen is not a bad place to start, and thinking about what it looked like last time.
Very good Very good tip. Yeah.
Yeah.
Good place to start. I can't see there could be a dramatic change to this draft.
Great, thank you. Something that we're really interested in at the council, because of work that we've been doing with the Karen network and through the publication of the report that Jessica Corner's task force on nursing, midwifery and allied health professionals, clinical academics was driving at, is about how clinical academics are reflected in the exercise. And there was a question about whether the substantive link mechanism you talked about through the HESA data collection will support identifying those clinical academics on joint appointments, and particularly perhaps those who are on maybe seconded rather than contracted joint arrangements. Yeah. I don't know what you can say about that. I know it's probably an ongoing discussion, but it would be good to get some perspective on that, Jo.
Yeah, it is an ongoing discussion. So we haven't got a position on this. But the discussion that we've been having is adopting the Academy of Medical Sciences, and Ed, I think that is the definition that currently is being worked on through the Council of Deans of Health group as well. So we might need to reflect on that in that group of a clinical academic. So where there is that, where the substantive contract is. We also, however, and this is a live discussion, recognise that there are different models for engaging people who are clinical within our work and within our research. And what we're trying to think through is the best way to represent them in the submissions where you don't have that substantive link because the HESA code challenge. So these are live discussions.
Great, thanks, Jo. I mean, and it's just really good that the panel's thinking about it, and I expect that's something that main panel A more widely will be picking up.
Yeah, that's just what I was going to say, Ed. So this is something that we need to think across, in particular main panel A. I would say in particular unit assessment 1 and unit assessment 3. Yeah,
great. Thank you. This is quite a technical one. It may be more for the REF team than for you, but there's a question about joint submissions and when there might be guidance on the mechanism for joint submissions.
So I think, as with all the guidance, with the plan is for all guidance to be out in the autumn. So hopefully that will become clear as part of that set of guidance.
Great, thank you. And then a couple of questions about the strategy, people and research environment section. So one, do you have a view or understanding of why the word culture was removed from the SPRE element?
I don't have any, genuinely, I don't have any insight into that. But what has been stressed, and hopefully I did put that across, is that we are interested in reading about culture as part of the submission, a part of the narrative for the submission. And I think that they're also thinking through the different indicators that we'll be expecting in that part of the submission also will be reflective of what we might recognise as things that represent culture. But I genuinely don't know what the rationale was for the removal of that word.
Yeah, thank you. Then a question as to whether the institutional statement within SPRE might disproportionately advantage research-intensive universities, and whether how panels will make sure that area is considered equitably.
Yeah, we're very live to the fact that the different percentage. I'm not sure necessarily. It may work the other way. So, for example, you could have a really strong unit level and then not a great institutional level, and that what that does to the overall weighting. We're very live to that potential, maybe not thought through consequence of that weighting. So we're thinking through how to manage. We'll be thinking through how to manage that through our working methods, including what I said earlier, that there's going to be an institutional level statement panel, and we're going to be looking at the unit level statements. So how we manage that assessment is also going to be really important. So those are exactly the sort of issues that we'll be working through between now and the autumn.
Great, thank you. And then
the point that's been recognised. No, I wanted to acknowledge that it is a point that has been recognised.
Great, thank you. No, it's important, and I guess particularly so in a unit like this one, where there will be research submitted by a very broad range of university shapes and sizes, and with different research profiles. So yeah, it's an important part of the consideration. The last question we've got at the moment, I think, a couple are coming on. So one, this may be one that you need to discuss with the panel, because you talked about this being something you were going to work through, but what reasons can you see the panel accepting for having more than 5 outputs associated with a particular staff member?
As you say, Ed, that's something that we need to be working through. I would be interested in colleagues' views actually on what would be your real reasons for why you would want to submit. I think I'd be interested in hearing that, because we will have to take judgment on that in people's statements.
Great, thank you. So that's another thing that if you want to put in the chat. So we've got the opportunity at the moment to put in thoughts about the draft descriptor, the taxonomy, long form outputs, and about reasons for submitting more than 5 outputs. So if colleagues on the call want to add something to that discussion now, please do put that in the chat now, and then we make sure that gets fed back. As I say, there will be opportunities to gather that information from colleagues separately, but this is a great opportunity to put that into the system and get it taken forward. The final question that we've got at the moment is about cross-referral to other panels. So do you know anything yet about how that might work?
Other than what we want to ensure is that there is a standard process for cross-referral. I can see the specific point is around lab-based health-focused research, and it's like Carol's asked the question. And if you'll see from the descriptor that actually the descriptor for unit of assessment 3 does include lab-based health-focused research. My experience of REF2029 is that we manage quite a lot of that within the unit of assessment 3, because we make sure that we have the appropriate assessment members on the panel to be able to make the judgments about lab-based research. Where they're not, where we don't feel we are confident, then yes, that's where the cross-referral approach will come in, not just for lab-based, but for other types of outputs. But those are processes that we'll be working on over the next few months.
Great, thank you. So there are still a few minutes left. If colleagues want to ask any further questions, or if you want to put comments in the Q&A, seen something in there suggesting that the chat's not accessible to everybody. So if that's the case, then please feel free to use the Q&A, because that clearly is working at the moment. So do put things in there, and thanks, Heather, for flagging that issue. But I guess whilst colleagues think about any further questions or any comments they might want to put in around the various issues you've raised for engagement, which is really helpful. Two things from me. One is, are you able to say anything about how you expect main panel A to work with the unit of assessment, the individual panels, and how that mechanism might work, and is any of that different from previous exercises?
So how we work, sorry, say again.
So working across how the main panel will work with the sub-panels.
Yeah, so very much my experience so far has, from a working practice point of view, is that essentially the main panel is the sort of mothership, if you like, and guides what we do within our sub-panel activity. And as I mentioned earlier, there's a real emphasis on trying to make sure as much as possible there is both consistency within the main panel.
Yeah.
Which obviously for us would be that sort of disciplinary consistency, as well as consistency of practice across the main panels, A to D. So we're working very closely as chairs of those sub-panels with Louise Kenny as deputy chair and myself, as chair, and myself as deputy chair of main panel A as well. So yeah, closely, I'd say, I'd have a sort of close.
Right.
Positive collaboration.
That's really helpful. And then a sort of general one, given that our audience will include lots of deans of faculty and senior leaders from across the nursing, midwifery, allied health space, is what do you think deans and maybe heads of research in those faculties should be doing right now to prepare for the REF based on where we are in the exercise and what we know at the moment?
Yeah, I think you hinted at some of it. I think you've seen now a draft descriptor and thinking about the sort of disciplines that might make up one submission. I know colleagues will be working hard on their, if they've not already submitted their codes of practice for assessment, working to the May deadline for their codes of practice for assessment. So really thinking closely about what the guidance is saying and how you adopt that, how you interpret that locally. Of course, I'm sure colleagues are involved in that process now. And in particular, I'd say if you've anything like our experience in Lancaster and other experiences that I've heard from other panel chairs, just doing a sense check on that HESA, that volume measure exercise, which is spanning this year and next year, because that's going to be critical for essentially working out how many outputs you're going to be submitting, and et cetera from there on flow. So very practical things to be getting on with whilst the guidance is still being worked through, I'd say.
Great, no, thank you. That's really helpful advice. And I think, that question about maybe that focus on the HESA return as the thing that will drive an awful lot of what else falls out of the submission in terms of how much you have to have of different things and what's going to be in scope is going to be really important. And there's a shift from previous exercises worth paying attention to in the detail, as well as how it ends up in the drafting. Great, that's really helpful, thank you. And we've had a couple of bits of feedback on the reasons for more than 5 outputs. So that's good to feed in. I don't know whether you've had a chance to look at those in the Q&A. And
those are the sorts of things that we have been considering. I mean, you can imagine if we get sort of 20 outputs from one person, what that might do in terms of flagging that. What we want to see is a representativeness. It's the balancing with research excellence of a unit with that representativeness point. So I think colleagues who have put the suggestions in the chat are helpful, and the sorts of things that we've been discussing thus far.
Yeah,
reassuring.
Great, thank you. And a couple of things. So first of all, to webinar participants, you should have just had something come up about a poll just to give us some feedback on the session. So please do complete that. But just before we close, there have been a couple of other points come in. One about, will there likely be an answer about clinical academics before the code of practice deadline?
No, I don't think there will be.
Probably not.
Probably not.
And then, do you have insight into audits that can be triggered by HESA volume changes? If my experience of previous exercises, anything to go by, the audit regime will not be decided until quite a long way further down the road.
Yeah, indeed. Although the principle of audits is starting to be discussed, but you're right, Ed. The mechanics of it won't happen until some way down the process.
But I would expect that, from my experience, that looking at unexpected variations in the HESA data may well be one of the areas that the audit could focus on as the exercise progresses. Certainly, if I were managing the exercise, that would be one of the things that I would be looking at. So I think that's it in terms of questions and comment. Oh, there was one, and we've had some feedback on the descriptor about diagnostic medical technologies being a potential gap. So that's helpful feedback. Thank you.
Helpful. And I think probably that's the sort of thing that might make its way into the taxonomy, but I've made a note. Yeah. Thank you.
Great. Fabulous. So, and Liz, you've asked about when the recording will be available. Josie, I'm going to defer to you on that one.
We'll edit this webinar as soon as possible, and it'll be available on the Watch Again section of the council's website as soon as we can upload it. Certainly this week.
Okay, so hopefully this week. So thank you very much, Josie, for that. We will, from the Council of Dean's perspective, be continuing to engage closely with Jo and panel about the REF team about as the exercise progresses, and particularly through our research policy group, we'll make sure we get feedback back around the issues that have been raised today to do with the descriptor and taxonomy, long form outputs and so on. So those of you who are part of that research SPG will be able to feed into that. But if you have any comments on those issues that were raised today that you haven't been able to make during this webinar, then please do just get in touch. You can contact me or Josie at the Council of Deans, and we're very happy to do that. And Jo's previously indicated that you'd be happy to take feedback directly as well. So
yeah, what I do need though, I need it in short order. So by the end of March, so I'd say by the 30th of March would be helpful.
Okay, so feedback on those issues as quickly as possible, and that would be enormously helpful. So thank you. So just to close then, huge thank you, Jo, for engaging with us today and sharing your thoughts. I know there's a balancing act to do in all of this because there's lots which isn't yet known and certain, and that you'll be working through with the panel. And it's really important to make sure that we're kind of fair and even-handed in the way that information is disseminated into the system as well. So really grateful for you sharing where things are in the exercise and providing us with the opportunity to engage on some of those open questions that are live at the minute. So thanks again for your contribution today. Really grateful for that. We will, I'm sure, welcome you back to another session with the council at an appropriate point later in the exercise. Just for wider understanding, we are also talking with the REF team directly about being able to contribute to our research month in June. So there may be an opportunity to hear from the REF team in some shape or form at that point. And we'll let you know more details about that as and when we have them. But for now, huge thank you to Jo for your session today. Thank you to Josie for navigating things in the background. And thank you, colleagues, for joining us this afternoon. Lots of great questions and comments. So it's been a really lively session. So thank you. thank you very much, everybody, and have a good rest of your day.